Hello, my name is Suzanne Barber. I'm a specialist midwife in infant feeding, a board-certified lactation consultant and tongue-tie practitioner. I hope this short presentation will assist you in making some informed choices for your baby. Sadly, there is a lack of expertise within the NHS, which often results in parents becoming confused and unsure of the best way to help their baby to feed. Tongue ties are often assessed as mild, moderate or severe, purely based on their appearance alone. The important point is not how they look, but how the frenulum, the little bit of skin underneath the tongue, affects the function of the tongue. In some NHS areas, there are dedicated clinics for the treatment of tongue tie, which may be run by surgeons or midwives, and these clinics assess the function and will treat within individual parameters. Sadly, many of these clinics have criteria which limit the availability of the service to certain age ranges. There is no evidence to suggest at what age a division of the tongue tie would be beneficial, so often the criteria is financially limited. In short, it's a pointless exercise for you to try and assess your babies visually, because a functional assessment is really required to decide if a division of a tongue tie is going to be beneficial. If you are breastfeeding, there are symptoms that should not be ignored. A baby that is causing pain while feeding, unable to maintain latch, losing weight or failing to gain weight are red flags. Sometimes help with positioning and attachment is all that's required, but if problems continue, it may be due to your baby's anatomy that these problems persist and not you. Bottle-fed babies also experience feeding problems that can be corrected with tongue-tie division. You may notice your baby is taking a long time to feed. Milk may dribble from the corners of the mouth, and some babies struggle to cope with the flow of milk and become overwhelmed. I advise you to trust your instinct. If you feel that something's not right, do get an expert opinion and assessment so that you can make an informed choice. And better still, choose a practitioner who is a board-certified lactation consultant who can support you with infant feeding. Depending on the source of information, you may have been told your baby has a specific type of tongue tie. There are many variations and classifications around the world, and here in the UK the main types are described as anterior, midline, posterior or submucosal. Remember at this point that the look is only half the story, and the very definition of a tongue tie is best described as a frenulum that restricts the function of the tongue movement and impacts on the organisation of your baby's ability to suck, swallow and breathe. A baby can have a frenulum that is attached to the tip of the tongue and to the gums, but still have full function, so therefore the tongue tie is not a tongue tie, as it's not significant to feeding. It is a normal frenulum. Parents are often confused when the tongue tie may be described as mild or slight, but they still experience significant feeding problems if it's left untreated. A tongue tie is only tongue tie when it's significant. If it's not significant, it's not a tongue tie. This is a typical anterior tongue tie. You can see it's restricting the baby's tongue lift and probably restricting the lateralization too. This is an example of a midline tongue tie, where you can see that the frenulum is creating a sail-like structure. So this would restrict the baby's ability to effectively latch and remove the milk from the breast. Here you can see a subtle posterior tongue tie, and if you look carefully before division, you can see it's pulling through the floor of the mouth. In the after division photograph, you can see a nice, clean, clear diamond, and the tongue's got the ability to really stretch up high, but importantly also come forward to scoop the breast. The other contentious issue is about wound management. You may read or hear that some practitioners recommend what we call disruptive wound massage. This essentially is massaging the wound bed or stretching the underside of the baby's tongue. I do not advocate this as a routine procedure for babies following frenulotomy. I have to, as a registered midwife, use evidence-based practice, and there is no evidence or research that shows that using this type of massage or wound management will prevent baby scarring after the procedure. Routinely, babies, roughly about 4%, will have some scar tissue after a few weeks post-division. This is something that can be easily addressed, and if you wish to discuss further, you need to speak to the practitioner who divided your baby's tongue tie. The risks of the procedure are rare or very infrequently occurring according to the National Institute of Health and Care Excellence, and the benefits of the baby exclusively breastfeeding post-procedure far outweigh these risks. The risks are generally quoted as infection, bleeding, scarring, and also the potential that the baby may not improve with feeding. These risks are all under 4% and very rare. Research quotes the chances of success following frenulotomy as the following. 86% of mothers notice an immediate change in feeding and comfort. A further 10% will experience this over a week or so, with about 4% of babies who do not improve. From experience, those 4% of babies tend to have multiple issues that are impacting on the feeding. I also hear a lot of mums asking about whether the folic acid they took in pregnancy could have caused the tongue tie. There is some research ongoing at the moment into this subject. However, if it was the case that folic acid in pregnancy caused tongue ties, I wouldn't see mothers and fathers and grandparents and siblings with tongue ties too. If you've had one baby already with a tongue tie, you do have a risk of subsequent babies being the same. It is obviously important to be aware of the symptoms so you can get timely treatment. Tongue ties are not on the increase. The prevalence is just better recognised and therefore treatment is more appropriately offered. There have been small studies which show that children with tongue ties left untreated can result in speech distortion or speech impediments. Children with a marked tongue tie often delay speaking, as it is quite hard work to make the sounds they need to make to be understood. Very often children are classed as being disruptive or frustrated because they cannot make themselves understood clearly. If you try and speak If you try and speak quickly with a tongue tie, very often your sounds do not come out as your brain is trying to tell you to do so. You can often find that speech can be improved following a tongue tie division. In this adult, you can quite clearly see the posterior tongue tie inhibiting the lift of the mouth, and because of this, the tongue's unable to sweep food debris from around these back molars, so this is where you'll very often find significant fillings. In this anterior tongue tie that is attached at the tip to behind the front two teeth, you can see this pull-in of the two front incisors. In the last 8 or so years that I've been dividing tongue ties, I've met lots of tongue-tied parents, and they often talk about the psychological impact of being tongue-tied themselves. Some are described as being difficult children because they got frustrated and behaved badly. Some of them lost their confidence because they felt and sounded different. Numerous dads have complained that they couldn't be able to kiss properly, and they felt sensitive about their personal appearance, whether it be their dental formation or the shape of their mouth. We cannot rule out the fact that emotional factors result in rising levels of stress, and it is a shame that for so many years I've left my tongue tie untreated. The psychological impact of being tongue-tied can start from early years and go right through adulthood. People talk about them being classed as naughty kids because they had behavioural problems, because they were frustrated, because they couldn't make themselves understood. some felt that they didn't have the confidence that they should have had because they felt or sounded different. And numerous dads have complained that their kissing skills maybe weren't quite up to scratch. I know that a lot of parents are very sensitive about their teeth and the formation of their teeth and how they look and sound. I think we have to acknowledge that most emotionally it can really increase your stress if you are inhibited. Lactation consultant called Alison Hazel Baker in the States summed it up quite nicely in the following statement. Potentially social issues may arise from tongue tie, self-esteem, compromise, social sensitivity, sexual performance deficits related to the use of the tongue, and difficulty engaging in the activities of daily living such as playing certain musical instruments, licking the lips, lollipops and ice cream cones. Little research quantifies these issues. Despite the lack of research evidence, anecdotal reports show that these issues can have a profound impact on the individual and should be seriously considered when making decisions. Alison Hazel Baker has concluded that early treatment may prevent development of problems in later life. I hope you've enjoyed this presentation, and if you want some more information about tongue-tie practitioners, please go to www.tongue-tie.org.uk, and if you want further information regarding my services, please access www.baby2breast.com. Thank you.